Today, the Maine CDC gave an update on its coronavirus response. These are the 3 things you need to know. Number 1, the Maine CDC is opening a new drive-through testing site at the Augusta Armory to try to help the need for more COVID tests in our state. The Armory is also a vaccination site. Maine CDC Director Dr. Nirav Shah said during today's COVID-19 briefing that they will generally offer PCR testing on the days they are not doing vaccinations. You must make an appointment. As for any potential federally sponsored testing sites coming to Maine, Dr. Shah said they've told them Maine needs more testing sites and offered the feds locations where they could put one up. And they're waiting to hear back.
It really is a big need. Let's be straight about that. Testing is a need in Maine and across the country. The ball is back in their court right now, so we're waiting to hear if those requests will be approved, and if so, when and for what duration.
The first appointments available at the Augusta Armory are for Monday, January 10. Number 2, Maine hospitals are noticing a frustrating trend. People coming to their locations asking for a PCR test to confirm the results of an at-home test. Maine Health is reminding people that the emergency departments, as well as walk-in centers and clinics, will not perform these types of tests. Dr. Shah says at-home rapid antigen tests are reliable, especially if you have symptoms.
The bottom line there, if you have symptoms of COVID-19 and you take an at-home test and it comes back positive, you do not need to seek confirmation of that result from a healthcare provider anywhere. You should take that result to the bank and start making sure you're isolating, staying home, wearing a mask, preventing others from being infected.
Remember, the new U.S. CDC guidelines say if you get a positive viral test result, regardless of if you have symptoms, you should isolate in your home for at least 5 days. That is regardless of your vaccination status. After that, you should wear a mask in public for at least another 5 days to prevent possibly spreading the virus. And number 3, Maine's public health officials are urging people to use higher strength masks to protect themselves against the more contagious Omicron variant of COVID-19. Today, doctors gave a little more insight on which masks are most effective. They say not all masks are created equal. Any mask is better than no mask at all. The next step up would be a cloth mask. But doctors say those are less protective than surgical masks, which are designed to prevent droplets from escaping or coming in. A KN95, that white one you see on your screen, is on the higher end of protection.
In an ideal world, surgical mask for everyone. Over the cloth mask is even better than just anything else. But if cloth masks are all that the individual has, that's still way better than no masking at all.
What I was really focused on is moving away from the neck gaiters and handkerchiefs toward either a multi-ply cloth mask, but even better, one of the standard surgical masks.
Dr. Shah and doctors from Northern Light Health say these same principles apply to masks that kids use as well. And those are the 3 things you need to know from today's CDC briefing.